picture of my own, hid it from me, and then tell me, can you come to do it the same in Islamabad? Who's doing lip depigmentations here? Nobody? Lip depigmentations. One? Only? Okay. To the best of my knowledge, this is the only method published in a medical journal to do lip depigmentation. Before I start, I have to declare I don't have any conflict of interest. Why people ask for lip depigmentation? I think nowadays there are increase in demand of facial aesthetics among everybody for selfie and for photos. Lip color, what do you think? Lip color, is it normal? Yes, it's normal. The answer is yes. Today we'll have hands-on. Everything, the patient, live demo, the patient is normal. Yes, the answer is yes. Okay, I think this is come from our cultures. Culture is essential in our museum, ancient museum, if you visited. And for the French people, I like this book. It's called La Description d'Egypte. It's still, there are no limits of passion of the ancient Egyptian of both colors and funny jokes. The first lipstick, it's invented by the Egyptians, by the ancient Egyptians. It's made of henna, and they found it in Merit's grave. So, after an excellent lecture of Sebastian in the anatomy, just to get it very fast, this is the skin of the lips, and this is the skin of the normal skin. In the skin of the lip, there are no hair, and it's completely different. Okay, let's see what's wrong in this. Pigmentation, it's mean we have excess melanin pigments. So, this bad melanocytes, it's rotated like this, it's full of melanin. So, my work is to target something to dissolve these pigments. Okay, but please remember always it's a medical issue. So, you have to go for the medical examination, medical assessment before doing anything. You have to make a proper diagnosis. Okay, I have to make the consent. The patient is not pregnant, the patient is not excessive alcohol intake, and the patient didn't take medications. Okay, this is very important. Let's start the story. The story, the patient came to my office like this and tell me, doctor, I cannot smile white, I want to be more pink. So, let's go for laser. This is the idea of aiming the laser, like you see now. Okay, I initiate my fiber and I work in a contact mode. This is a fiber. I try to ream it and I work in pulsed mode. This is giving the luxury of laser by decreasing the thermal relaxations and peeling immediately and give the immediate result for the patient. I choose to work in pulsed mode in high power. Okay, and I say everything, don't worry. Then I start first with biostimulation. Biostimulation is an excellent tool to decrease the pain for the patient. Then I go to change the power. The most important thing in laser is chromophore. So I use diode lasers. I use 10 nanometers in these procedures. This is after doing depigmentations. Okay, I can do it also for the tongue. Okay, I take the ethical approval. And I study the physics, it's Professor Meister. Since 3 years I do 65 cases, and now there are 12 practitioners who do the same technique. I have the selection criteria. I make well-motivated patient, no underlying pathology, and not pregnant. And I tell the patient, very important, maybe you have some social lag for 1 week, but nowadays, no social lag. Okay, I publish my technique, and this is my technique of depigmentation in full details. I start with biostimulation first. Biostimulation is an excellent tool. It will decrease the bleeding, decrease the pain, and also excellent if I go for the lymph nodes for the area 1 and 2 and 3 and 4 and 5. This is very good to guarantee zero bruising for the patient. Then I go for my peeling. This is a parameter I use in my work. Okay. And I do something. The patient is annoying too much from the smell. So I put some Arabic oud or Arabic smell in the patient's nostril, and I get my assistant ready with high suction. It's very good. I have another secret. From time to time, I ask my assistant to have a cold saline. It's very good. And after finishing the procedure, I advise my patient to take a KY gel as a lubricant to decrease the pain. From time to time, I stop. And most of the time I do this procedure with topical anesthesia. I don't numb the patient. Why? Because I like to keep a pain as an alarming sign. I don't like to burn my patients. See how beautiful the result and how beautiful the patient can become pink immediately. Okay? Sure, if you can go for the lower lip, you have to be very cautious. Why? Not to induct mucocele for the lip. This is the way I'm going to do. It's very important when I'm aiming saline, I like to take care. I don't like to aim for the laser. Why? Because I will decrease the laser efficiency. After I finish, from time to time, I make biostimulations, and this is one of the luxurious use of the lasers. Sure, when you do laser, you should implement all the safety precautions. Okay, this is another case, and this is after. And this is another case. Let's come to the question. Does it relapse? Yes, it's a natural process. When? After 1 to 2 years. I have cases 10 to 3 years with no relapse. Okay, social lag for 1 week. Is it painful? It's like a hot spice. Okay? Need post-operative medications? Yes. I give analgesia. I give anti-edema for some patient. I never give steroids for one patient. I give the patient instruction, what to expect, what to do, what to avoid. You expect slight pain, you expect slight swallowing. What to do? Take painkiller. What to avoid? Avoid alcohols for 1 day. When not to do? If the patient is critically ill, patient with pregnant patient with a medical disease, red flags like infections, like anything. Okay, this is my kids. Now I think this is a 3 years technique till now. It grew your contributions. At the end of my lectures, I wish this lecture it open door like this. You know what's the door of this? This is the door of King Tut in Egypt, and this is my contact. I'd be more than happy to answer your questions if you have any questions. Thank you for your time. I'd like to invite you to my conference. Thank you so much. Dr. Jamil, but I do my best. Let's go for lip depigmentation now. Okay, I start now on lip depigmentations. First, we have to make a laser safety. We wear our goggles. I apply the numb cream. I don't like to make anesthesia injections for this patient. In some patients, I give bilateral infraorbital blocks. Okay. Before I start, I like to make biostimulations. This is very good to decrease the pain and guarantee zero bruising. Now this is our laser. Okay. I ask the patient to remove the stuff. Can I have some gauze, please? Okay. If you have any pain, just raise your right hand, not left, not raise my face. This is biostimulations. It can give the patient certain kind of numb, by the way. Usually we do biostimulations for 30 seconds all around the lip, like this. Okay, now I have to connect the fiber. Can you connect the fiber, please? I connect the fiber of the lasers. It's very important you should have initiate the laser fiber. Why? I reinitiate it again to show them. For me, I'm obsessed. I like to usually to initiate my fibers. Why? I like to check the aiming beam. Everything is fine with the machine. Here, this is initiation. Yes, it's fine now. Okay. My laser is ready. Okay, the key, I have to move very fast, not to burn or to make pain for my friend. Do you have any pain?
On a pedal.
You have pain? Okay. Everything is fine? You have to press a little. See how the pigment is done? We can go fast like this. Okay.
Going like this. We remove the pigments and going for the other side. Okay. See the pigments gone now? It's very safe feeling without any. The secret, I like to move very fast. Okay, I go for the upper. Now the pigment is gone from the lower, and from the upper, I like to go for the middle, and that's it. Still have fine pigments, I have to get a low power now. Almost I finish. See, now it's a crust, the crust has come now. Okay, this crust will take 1 to 2 days to fall down, and he will keep a very pinkish lip. Thank you so much. Usman, still alive?
Still
okay. Thank you so much.
Should I finish it?
Okay, that's fine. Can I paint?
And I hope Usman will take it as possession from something continues.
I cannot say this for him.